Port Moresby goes into lockdown again as coronavirus hits home.
The Provincial Task Force kicks into action, having planned for this since January. Their message to the public is clear: stay calm, obey the rules.
An already beleaguered healthcare system faces its biggest nemesis. The entry of Covid-19 into Port Moresby is nothing short of a double whammy. These lines of people waiting to be tested at the Rita Flynn Isolation Center gives an indication of the upcoming pressure on the frontline workers of the country. But the Provincial Task Force has another challenge to deal with. In the war to mitigate the spread of the virus, the economic health of the city shouldn't become collateral damage. A result of this tightrope act between the two was this opening of a market at wildlife, a measure to look after the interests of the informal sector.
People like helping Yupla, the informal sector, to be independent. All mama me must market. Time me working market to me roll out long SME. I think 500 mama, it benefit lo this like SME roll out for me. This is your life. This is your bread and butter on the table. Awesome, that's why we brought the market to your doorstep. Look after it.
But the event had turned into a huge health hazard, violating the mandate of the state of emergency imposed in the country. But a leader must walk the talk, and that is what was displayed in full fury when the opening was abruptly called off.
People play me, depend on market, look out him all, bring him income, look out him picking family, na community play me. It's not easy. Custom lo Papua New Guinea, culture play me, all in pass, sing, share him kai, share him kamban, share him boy. You know, you see lo me plus stop him mesa. But me must work in this edition in order to protect all of us. You plus some lawyer in no kai boy lo tupla moon, you not die. But suppose virus I can not see you, chance for you to die am high. So not today, you may not have open market. When you are ready, you blood talk seven and we by come na cut ribbon. Now we are ribbon by stuff. Me like him by market over here, help him you me. But you blood no hurry talk. You blood no help him me, help him you me. You blood community, you blood go back, you may all get again go now. Thank you.
Some distance away, JMAT, a reputable business house, follows in the task force's footsteps.
When the things break out around February, we already thought about the social distancing because it's already in the news all over the world.
In addition to the staff wearing masks and basic hygiene practices being adhered to, the management has introduced thermal screening at the entrance.
If the customer with a high temperature will be just send them home. So whoever is above 37.5, we let them know, sorry, we can't let you to in because we want our customer and our manager and our staff to be safe.
But for the business community, keeping the wheels of the economy running is also important. The Port Moresby Chamber of Commerce and Industry is optimistic of a revival when things return to normal.
Well, it's had an immediate impact on all businesses. Some businesses have been really affected, and in particular the airlines, which have been ordered to shut down, so the tourists have not been able to come in, and that's had a direct impact on the hospitality and tourism industry. Employees' welfare is the number one concern of all business houses at the moment, and we're doing what we can to keep as many people employed. Of course, the other big challenge is that the informal sector through the betel nut market, that has now been banned. So unfortunately, those people who are vendors who relied on betel nut is having an immediate impact on, they have no income now, no sales, therefore no income. But for most businesses, people are resilient, they're used to doing business here, and it's not an easy place to do business. So businesses will strive and get back to normal once things return to normal.
Earlier last week, the Provincial Task Force provided a platform for the health workers to air their concerns. Easily the most at risk, these doctors and nurses from the public sector have a hard decision to make: duty versus self-preservation.
I know it's not easy. You didn't sign up because you want to face a pandemic. This type of situation does not come to us by choice. The government did not ask for it. Our people did not ask for it. Our country did not ask for it. You have my assurance that we will help you to mitigate the risk. And so if some medical officers want to opt out, this is a time where it becomes a question of life and death. And therefore, I'm not in a moral position to say, no, we will terminate you. So I want to leave it to you all to make a commitment. Whatever box that you want us to tick, we will take it. And you have that assurance from me.
An emotional call to action also issued by some of Papua New Guinea's eminent doctors and health administrators.
I need you guys now today. It's a big collaborative effort. It's not a one-man show. Come in, let's collaborate, let's work together, let's get the facility ready and operational for Port Moresby.
We health workers are committed 100% or even beyond 100%. Our duty, uppermost, is to protect the community.
Make sure you don't get sick. And if you lose 1 or 2 doctors, we've lost.
The reality on the ground comes as a rude wake-up call. The concerns and problems pour out.
When some of our staff were sent to the place where they were COVID positive, for example, Rabaul, and when they are coming back, the staff is going under 14 days quarantine. If we do 14 days quarantine to all the staff, we don't have lots of staff. The staff will finally run out and we will have no one to look after our COVID patients.
We all know that NCD does not have a public labor ward. It's only Port Moresby General Hospital. And I don't have PPE.
After a patient hearing came this assurance.
We are also looking at the risk allowance, insurance. We are also looking at that too for insurance cover. So you all have that assurance and support too. We are looking at facilities by which you can use as a temporary health village, where you don't have to go home to risk your families. Your PPEs in the front line to provide you the best support. We have purchased what we can to ensure that you are given the best protection that you can.
Recognizing an overall shortage of PPE in Port Moresby, the NCDC has promptly moved in to plug the gap by providing masks, gloves, and other gear to various sectors of the city.
We're working closely through Governor Parkop, through the acting city manager, Ravi Frank, to make sure that we are integrated with the Provincial Health Authority model. We have worked with them to stockpile personal protective equipment. We're doing that through a makeshift warehouse that we've set up at the Tarama Aquatic Centre next door to us here at 3 Mile.
At the St. John Ambulance Hotline Centre, the team works hard to ensure critical care services are still running seamlessly.
The ambulance service is running as usual at the moment. We do expect if COVID comes that we'll see significant increasing demand, and there is concern that health services could be overrun.
IMT base over and out.
The coming weeks will test the Provincial Task Force's capacity, but not its commitment. As this dedicated team works to keep you safe, Port Moresby, follow these simple rules. Wash your hands with soap or sanitizer. Maintain social distance. No public gathering of more than 4 people. Stay at home. Only step out in case of emergency. If you're sick or have a high fever, call 1-800-200 to get advice, or 111 ambulance service to pick you up at critical time. Stay safe, Moresby. See you next week for more updates.